13-year-old girl clutching her crotch, screaming in pain, mumbling gibberish, eyes twitching fast. Doctors think she might have been sexually assaulted. They look at the stepdad, cause mom says the girl's been sick, didn't go to school. Stepdad's been taking care of her at home. He's the main suspect, but before the tests come back, the girl starts convulsing, loses consciousness. Doctors rush to intubate her, send her to the ICU. Spinal tap shows she's got herpes type 2, common in genital infections. Mom hears this, nearly falls apart. Doctors want a full pelvic exam. Stepdad speaks up. He asked if they could clarify the situation before starting the examination, but the girl's mother insisted they couldn't wait any longer. She wants to know the truth as soon as possible. Pelvic exam shows severe damage and a torn hymen. All signs point to assault. Bruises suggest it happened 5 to 7 days ago. Mom's shocked. The girl's been with her husband the whole time. No other guys visited. Mom has the worst suspicion, but can't believe it's true. Police interrogate the stepdad, but it's not going well. Detective Haas doesn't think he's the suspect, cause he's willing to take a lie detector and DNA test. Usually, criminals avoid tests, but there's a new clue. Trace amounts of triazolam in her blood, a hypnotic sedative. The hospital didn't use it. The detective suspects other medical activities. Dr. Manning remembers the braces. The girl got them a week ago. Dentists sometimes use triazolam. The detective knows who to catch. The truth comes out. It was the dentist who assaulted the girl. He used triazolam to knock her out, so she doesn't remember the assault. The nightmare hurt her body, but her innocent heart stays pure. Everyone agrees to keep the truth hidden, hoping she'll never find out.
We understand.
A woman gives everything to deliver her baby. To her shock, the newborn is still in the amniotic sac. Even more surprising, the doctors don't rush to save him. They calmly set him aside, because the survival rate of this 22-week-old baby is extremely low. Its parents signed a waiver of resuscitation long ago. But soon, the doctors are amazed to see the baby stable and healthy looking. They quickly assist with a second delivery, and once the sac is cut, the baby is officially born and his vitals look okay. They rush him to the NICU, but a pediatrician soon has to declare him dead. Weighing only 490 grams, most of his organs aren't developed.
This baby is not going to survive. The best we can do is make him comfortable.
The parents signed the agreement, so the doctors can only provide palliative care. But Dr. Manning, feeling compassion, tells the mother there's still hope. She encourages her to hold her baby, but suddenly he goes critical. Despite the agreement, the mother changes her mind and asks the doctors to save him. The authorized doctors quickly get to work, hooking him up to tubes, and his condition stabilizes for a moment. The father arrives and gently offers his finger. Miraculously, the baby grips it, exciting the new dad, who thinks he's improving. The doctor warns not to get hopes up. It might just be a reflex, but Dr. Manning insists it shows good movement and survival chances. However, alarms go off again, indicating he's critical. Despite immediate CPR, he's too fragile and passes away. Before leaving the hospital, they thanked Dr. Manning for giving them time to be with their child. Although it was very brief, at least they had that moment. They then left the hospital with a sense of loss.
I had to make you feel a little better.
I did.
But what are you gonna do next time?
As a doctor, it's truly a taboo to empathize with patients' families. This girl is such a drama queen. The doctor slapped herself, and the girl screamed in pain. While the doctor was helping her mom bandage wounds, the girl complained about a headache. When another patient had a seizure, she suddenly collapsed too. Her mom was at her wit's end, juggling a busy job and constant calls from school, headache, stomachache, or anywhere else. She was stressed and close to losing her job. But when her mom scolded her, the girl insisted,
I'm not just making this up.
Faking it, Dr. Manning looked at the girl's medical history and saw that all her symptoms were made up. She suspected psychological issues and suggested Dr. Charles talk to her. Charles limped in due to arthritis, and right away, the girl touched her knee.
Your leg okay?
All of a sudden my knee hurts.
This raised a red flag for Charles.
Sometimes my feelings aren't my own. Ow!
He showed the video to her mom and diagnosed her with mirror touch synesthesia, which means she feels what others feel. So when Charles felt pain in his left knee, she felt it in her right. Her stomach pain was because her mom had an ulcer. She wasn't imitating. She was genuinely feeling it. Though it can't be physically treated, it can improve with visual exercises. Watching her daughter, the mom realized that while the girl was in pain, she was also dealing with her mom's criticism. Suddenly, she felt her daughter's helplessness and frustration.